What is up? What is up? Welcome. We are live. It is Friday. Thank you all for being here today. We're going to go over a bunch of different stuff today. Thank you for those of you who have put comments and questions this week. Thank you so much. So my name is Dr. Nathan Kadlicek. I'm Dr. Physical Therapy. I just upgraded my camera, so you might notice something different. It is a nicer camera now. I don't know if the sound might be a little echoey, but it's because I don't have my microphone plugged in. I'm just going to test that out today. But thank you for joining. Today we are covering a bunch of different things. Hey, listening and walking. What's up, Lisa? Hope you're doing well. I've got some really cool stuff coming down the pipeline, and I'm happy that you're in here, Lisa. So today, here's what we're going to go through. So we're going to do a Q&A of different topics and questions people have asked. We're going to talk about the giveaway a little bit that I created. It's for a $200 Amazon gift card and a year-long subscription or membership to the new membership site that my brother and I are launching. My brother, you guys haven't heard of him too much, but he's working on a lot of stuff behind the scenes, so I'll have to get him on the camera at some point here. I think he's a little camera shy, but we'll get him on here. So we're doing this thing together, so that's pretty cool. But and a book suggestion, so I'm going to make a book suggestion today too. I'm going to put all the links in the comments today, and I'll update it and put it in the description as well. So let's get into the Q&A. And of course, if you're here, just go ahead and say hey. Just type it in, say hello. Helps the YouTube algorithm. This is not YouTube, this is Facebook. Helps the Facebook algorithm send more people to the group. So number one here, Samantha was asking about her back. And I just want to find that really quick. I'm on my phone here. So she was saying that she was having, 4 months of severe back pain. Hey, Elena, what is up? We have a lot of nurses in here, Elena. There's another nurse that just joined. There's probably there's a lot of nurses. So it's pretty cool. I love helping my fellow healthcare providers. You guys deserve it. So backstory, when I was 15, I was water skiing, tried to drop a ski and fell. When I fell forward, I scorpioned my back head to toes. That sounds painful. It was very sore when I couldn't sit for 2 days, but I never went to get it checked. Fast forward, and I am now 28, and I went to see a chiropractor who took x-rays. As I started having low back pain, she said it could be from the previous injury that was not healed properly and is now inflamed. She also said it could be my SI joints causing the issue. Okay. Now, due to the pandemic, I am now home and not working, and thought I'd do some gardening and landscaping, pulling out hedges, cutting down branches, pulling out vines and weeds. Needless to say, I have done something to my lower back in the lumbar/tailbone area. I've had an x-ray and CT scan done, and they show nothing. Okay. I have been told by my new chiropractor to do small exercises for the area of my back, but the pain hurts too much. Taking baclofen for the spasm and pain. Help! Okay, so let me first invite you to this, Samantha. Okay, so Samantha, it sounds like you are dealing with a back spasm. I didn't see something in the lower back. It doesn't look like there's any numbness or tingling going down your leg. It looks like this is really a back spasm that you're dealing with. And back spasms can be really painful. They can be really scary. It can be hard to even move because they're so painful. So number one, if it is indeed a back spasm and you believe it's muscular, the best thing to do is to keep moving. I know that sounds like, what are you talking about? It hurts to move. I know, but finding ways to move that can help you. Now, the exercises, the small exercises for the area of your back, I'd be interested to know which ones you're doing. So I made a video that walked, I think the last live I did, or 2 lives ago, live Facebook Live, talked about what you can do to screen yourself. So, for example, can you bend forward? Can you bend backwards? Can you rotate side to side? Which one feels best? And then you can create a workout program that is like that. It doesn't have to be just random exercises. You can actually determine a lot of the times which particular motion is the most comfortable for you. So that is what I would say. It sounds like it's a pretty significant spasm. And there's probably that fear that it's not going to go away. Like, is this something like insidious and dangerous? In most cases, it's not. And for you, it sounds like it happened when you just did a lot around the house. So I would say that it's probably a spasm. And finding ways to get moving more. So that can be walking, that can be cycling, that can be swimming. I know that a lot of gyms aren't open and pools probably aren't. But I've made tons of different YouTube videos about back spasms also. So I would encourage you to check those out on my channel, because I do have that as well. And if you're watching this on the replay, then you can also just comment, and I will do my best to comment back. Since there's more people in here, it's harder for me to keep up with all the questions on a real-time basis, just like typing it out. So these live videos are actually getting better because there's more questions, which is good. So yeah, hope that's helpful for the back spasms. Again, I need a little more information to give you more direct feedback of what you could be doing. Okay, so Lynette, you asked a bunch of great questions. I'm going to now tag you. Give me a second here. Lynette, there we go, Lynette Cole. Thank you for all those wonderful questions, Lynette. Appreciate that. So what is the difference between a twisted spine and scoliosis? So I don't think twisted spine is actually an actual like diagnosis, like ICD-10 code. Maybe it is. I haven't actually put that in there, but it's probably just another name for scoliosis. And because ultimately, like scoliosis, there is some sort of twist and turn. It can be a S curve or it can be a C curve. An S curve is just like 2 curves in the spine, and then a C curve is just 1. But honestly, like unless you have really, 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 really severe scoliosis, like you're literally hunched over, then usually it shouldn't be too much of a cause for concern. People who do have large amounts of scoliosis to the point where it's impacting their breathing, like there are people who literally are bent over like so, and they have to get rods placed to correct that because it's actually impairing their breathing. In those cases, yes, that is an issue. But in most cases of scoliosis, it's a normal anatomical variation. A lot of things that we find on X-ray or MRI, like a leg length that is longer than the other. What's another one? Cartilage that is different on one side rather than the other. Scoliosis, just different types of bony growths, like even bone spurs. A lot of these things are normal anatomical variation, and most times it's not something to be concerned with. Now, of course, there are times where it is a different anatomical variation that is contributing to some of your symptoms, but we don't want to immediately jump there because it could be just a normal thing that's always been there. Posture corrector. So, I mean, I think the benefit of the posture corrector, if you're talking like a back brace or something like that, would be that it's helping support you. And oftentimes when people feel supported when they're having severe back pain, it can help alleviate some of the symptoms. Is it going to quote unquote correct your posture? I I'm going to have to say no on that. And the bigger question is, does your posture actually need correcting? We've talked about this several times in past videos about how posture itself, it's been just taught over and over and over and over and over again that you have to have perfect posture, and you have to, sit with your, I'm even slouching right now, right? But I should be, according to everyone, be sitting like this at all times. I shouldn't be sitting like this. But the reality is that our body was meant to move, it was meant to change postures, and so ultimately, if somebody thinks that they need to adjust their posture, which they might need to adjust it because they're always in they're in one particular posture. I think that's more important, is changing up your posture throughout the day versus let me, just wear this brace or do these weird exercises. Like, it's more of just changing your positioning throughout the day, especially if you're in an acute flare-up of back pain or any other type. Can a back injury cause deformities? Yes, it can. If you have like a fracture that doesn't heal very well, or you have really significant pain that causes you to hunch over in a certain way, like, can it cause deformities? I think I see this most often in older individuals, like 65, 70, really like 70 plus, who have a lot of kyphosis or bend through their middle back. So it's kind of like this. And I see that more often in people who are in their 70s, 80s, 90s. I think part of that is, part of it's just like the disc height decreases, and sometimes people get less active as they get older, and then they have more pain, which then causes them to hunch forward, and it becomes this habitual thing, and then over time it becomes more of a permanent thing. So sure, I think that a back injury or back pain could lead to some deformities, but it's probably pretty rare unless you had like some sort of trauma, or you're 65, 70 or up, and you've had it for a long time, and you feel like you've been stooping over for a while. But again, our bodies are very resilient, and they're able to adapt to many different stresses, so that's probably less common. Types of infections. What types of infections can you get in your spine? So there's osteomyelitis, which is the most common one that I'm aware of. I'm sure there are other types, but osteomyelitis, so that's an infection of the bone. There can be various types of infections, of course, but I believe that one is a bacterial infection and is treated with antibiotics. The way to differentiate an infection from just like a spasm or whatnot, an infection, typically there's going to be, well, for one, there's severe pain that usually is not resolved with any sort of movement, and there's usually a fever accompanied with it. If you had like a cut or a scrape and it got infected, like, it's possible that then that can travel to the spine. That's super rare. Again, like infection, cancer, and cauda equina syndrome are incredibly rare. They're like less than 2% of cases, like of those three. So it's unlikely that somebody is dealing with that, but again, it's possible. So that would require antibiotics. Yeah. And then let's see, Jessica had a question too, I think. Let's see. No, that wasn't a question. Yeah, so those are the main questions that. Oh, and then Alex asked, is there anyone dealing with bulging discs and a hematoma? I'm posting for my husband Alex. He's super fit and has experienced some back pain in the past that he has managed well with targeted exercises, but he injured his back backpacking with very heavy backpacking hours of kayaking. Pain is getting worse, movement very limited, no pain in arms or legs. MRI showed bulging disc and hematoma. His video appointment with spine specialist isn't until Thursday morning. And that was 4 days ago, so he likely had the MRI now. So I'm going to tag you in this, Alex. Boom, Alex Algons. And let's see. So that's how long post-Horizon? So I don't know how long he's been dealing with it. And I don't know all of his symptoms. And when you say hematoma, how large is the hematoma? Has it gotten worse? That's interesting. There's a hematoma there also. But for one, again, backpacking with very heavy backpack and hours of kayaking. He seemed like kayaking caused it. So oftentimes we just do too much and we exceed our body's threshold to tolerate a movement or type of activity, and that is why we end up having a lot of these symptoms. Is it due to a particular structure being damaged? There's probably some amount of irritation that's caused to different tissues in the back, especially if you exceed their tolerance. But in most cases, when somebody does something like that, doesn't have any pain in arms or legs, then that's something that should recover with time, exercise, and just getting proper amounts of sleep, nutrition, all that type of stuff. I probably wouldn't have gotten the MRI in terms of what his symptoms were. I know the pain is getting worse. If he fell or something and thought that there might have been a fracture, I might think differently. But the fact that he didn't actually have, so the indications, and I posted this a couple weeks ago. The indications for an MRI or an X-ray is, do they have trauma? Do we think there's cauda equina syndrome, which is any sort of worsening numbness, tingling, weakness, and loss of reflexes, and then bowel and bladder loss, unable to control it or go. So if you have those, or you're thinking it might be an infection or cancer or something like that, then it makes sense to get the MRI or the X-ray. It does not make sense to get it, and it actually leads to worse outcomes if you get it early. So getting early MRIs has been shown to actually produce worse outcomes because you have a higher likelihood of getting surgery, you have a higher likelihood of getting aggressive doses of medication, and you have a higher likelihood of just a very poor outcome. So that's why I'm very strongly against getting an early MRI unless you have the specific symptoms that go along with it. And usually we're pretty good at screening those things out. And even if you have red flags, it doesn't mean that you actually have the thing. So the prevalence of those things is actually quite low, of those cancer, fracture, and whatnot. And it needs to, if your husband came in to see me and he said, my back hurts and I've been backpacking with a really heavy backpack and I was kayaking for hours, I'd ask him, okay, how often do you do that? And if he told me once a month, I said, oh, okay, well, you did too much. And let's work on building up your capacity so that you can do more of that. Now, you said that he is super fit, so he probably does stuff like that all the time. So this could be a random occurrence of back pain too, where he just maybe exceeded his threshold, especially if it was a really intense workout. So those are my 2 cents and 3 cents on that. Any other questions for me, y'all? Any other questions? If not, I'm going to go into a book. I'm going to actually talk about the book suggestion first. So it's a great book. It's called Why Do I Hurt by Adrian Lowe. It's actually a workbook for pain. Doesn't matter if it's back pain or knee pain or anything, but it just is a workbook to help you work through pain and have a better understanding of it. So I'm going to post a link there. This is not an affiliate link or anything. I get no money from this, although I should do that. I should put an affiliate link there, but I'm going to put this in there. Highly recommend this book. Why Do I Hurt? It's just this guy is an amazing researcher. He is just a great presenter and a great clinician. So I'd highly recommend that book. And again, it's not like I don't get any money from that, so I just want to recommend it. Let's see. Elena, you have a question. With my injury in particular, and everything with my leg had become atrophied, like 2.5 inches smaller than my other. Is this something that is normal? I mean, it's normal to have, like, if you can't move your leg, yeah, like it will be normal in that sense that it is atrophying because you're not able to use the muscles. That's normal in the sense of if you have an injury that's causing that, then that would be a normal progression. Is it normal for a normal human who's not having an injury? No. People on bed rest, like you're aware of, can encounter lots of atrophy with disuse. So yours is basically disuse atrophy and just being unable to use it. So it's normal within the course of what you're going through, but it's not necessarily a normal thing of daily life, if that makes sense. Does that answer your question, Elena? Okay. So that So that book, Why Do I Hurt? It's a great book. Would highly recommend it. It's like $15. And then what's the next thing? Oh, the giveaway. So if you haven't already, you better participate in that giveaway because it's $200 Amazon gift card, and it is also a free year to hold on, I'm going to copy that. It's also a free year of membership to our new membership community site that my brother and I have been building for you guys. So let's see here, and you can enter here. So I just put that in so you can enter there. If you haven't already, there are 6 people who've already entered. So if you haven't entered now, and then one person, I'll tell you right now, one person has like 65 entries already. So they're getting after it. Whoever's got the 65 entries, nice. So if you're not there yet, you better get on there. So Lisa, you said, I'm curious. During my neck fusion, they found a lot of bone growing where it shouldn't. Not just a lot of bone spurs, but we've got bone growing on the spinal cord ligaments. He said it was extremely difficult to remove it safely. He did remove it in the fusion area. Can that grow back after? Just curious with my increased stiffness and pain. My knee surgeon suggested it could. You know, it probably can. Like if it grew once, it can probably grow again. So ossification on the nerve, yeah, that's pretty interesting. I'm just going out on a limb here. I'm going to look that up and make a note of that. So it's probably called like neuroossification or something. So I'll look into that. That's interesting. Neuroossification. Yeah, I would assume that if it happened before, it can happen again, but I don't know that I would attribute. I'd be careful before you attribute current symptoms to past symptoms. Like a lot of people will say, well, I did this thing 18 years ago and it feels the same, and so it must be the same thing. It's not always the case. It's probably rarely the case because our bodies are much more resilient than that, but our bodies do have memory And in fact, they likely have a pain memory where it gets imprinted in our brain of what it feels like and what the environment was like when we first injured ourselves and what that experience was like. So it's possible to actually experience pain similar to what you felt before, but it's not necessarily the same thing. There's a great TED Talk on that actually, and just dropping, it's Lorimer Moseley. Lorimer Moseley TED Talk. I'm going to put that in the description too. This is in 2011. It's a great video, and I'm not sure what's going on here. Oh, there we go. Okay, so I'm going to put that in there too. Knee surgeon called it diffuse idiopathic skeletal hyperbiotosis. Interesting. Yeah, I've never heard of that. But just because I've never heard of it doesn't mean it doesn't exist. I learn new things every day. Well, thank you for bringing that to my attention. Now I can put that away in the brain here. Hyperbiotosis for reference. That is interesting. Okay. Cool. So that's the. Yeah, that's interesting. I'm gonna do some homework on that one. Yeah. Let's see here. What do we got next? Oh, okay. So when I posted, the last thing I wanted to talk about was the feeling. Actually, I'm going to add Wendy and Dave to this before I go to the next thing. Dave, and Steve. Sorry, Steve Stevenson. Let's see here. Oh, okay. I don't know if this was Maria. I'm gonna put Maria in here too. Maria. So the question seems to come up commonly, Maria Lombardo. The question seems to come up quite frequently of, I'm afraid to make things hurt more. I'm not sure where to go from here. And that's totally understandable. Basically, everyone who is in this group is kind of in that same boat. And my encouragement for that would be that you can just start small. You don't have to go out and do crazy long exercise sessions or anything like that. And not knowing where to start is definitely hard. And that's why I made that one video about understanding whether you have a red flag or not. Once you've screened out whether you have a red flag, then you can go through a movement screen for yourself and find which movement feels better. If there is a movement that feels better, then you can create a program or mimic exercises that are similar to that motion, and then progress from there. So that's the best thing that you can do for that. Let's see here, start physical therapy. Cool. Well, I'm glad to see that you're starting physical therapy next week, Steve. That's awesome. That will be good for you. How did that shot work for you? I'm going to start posting some more research about injections as well, because they're pretty common. There was another, let's see here. There were a lot of comments this week, and thank you for that. So I need to, again, add, let's see. Jen Marie too. At Jen Marie. There you go. Yeah, so the injections can be helpful for particular cases, especially if there's like symptoms that are going down the leg. Can be helpful for that for sure. Some people find it helpful, others don't. It's kind of a hit or miss. And there can be some harms with excessive steroid injections, cartilage degradation, that type of stuff. So you would just want to be careful with how many you're getting. Let's see here. Yeah. Okay. I think I got through basically everything there. Okay. But I did ask a question about people being stuck. I think that was last week. And I just wanted to get back to that if I can find it. For some reason, I'm unable to find some of these posts that I make, which is frustrating. Well, anyways, some people felt like they were stuck in a place where they couldn't exercise, or they couldn't walk, or they couldn't sit. So my encouragement would be, if you can't sit, that means that you're probably flexion intolerant, which means that any sort of bending forward probably doesn't feel great. So I would encourage you to work on some more extension once you have screened out any red flags. Okay, so extension is backwards bending. That can be on your belly, that can be in a chair, that can be standing, that can be in a half kneel, that can be in a lot of different positions. If you aren't able to walk, then something that can potentially help with that is, depending on what your body responds to, some people who can't walk actually like the backwards bends. So backwards bends, forward flexion, so bending forward, maybe doing that starting in a chair, those types of things. So sometimes that can be really helpful. It just depends on what your presentation is. And then, hey Shafiq, what is up? What is up? How's the walking going? How's the walking? And then, what was the other one? Sitting, standing, exercise. Yeah, I mean, if you can't exercise, it depends on what type of exercise you're doing and what is flaring symptoms up. So there is usually a progression that I can take people through that will help them get back to exercising. Sometimes it's a long road, several months, even sometimes years. I posted in here just, I think yesterday or 2 days ago, that sometimes the recovery process is long. And sometimes we need to adjust our expectations so that we're not continuously disappointing ourselves when we don't reach the point of full recovery, or an acceptable recovery in our eyes. So it's important to keep that in mind. Let's see, Jen, you said I have a herniated L4, L5, had been bedridden since June 2nd. I was laying in bed on my belly the whole time. I was given 900 milligrams of gabapentin, which I cannot take, knocks me out of care for a toddler. I'm stuck because I can hardly walk or sit at all. Rehabbing my own back, I've tried draining allergic stem, lidocaine, like therapy, and lots of swearing. Sometimes the swearing works. I don't know. Yeah, herniated L4, L5. That's since June 2nd. That's tough. That's really tough. Let's see. So you've been rehabbing your own back. It's really difficult. Is it possible to work with somebody virtually who can help, like with your schedule? Because I know you've got a toddler, it's probably hard to make it in. It's difficult to know the progressions. You might be missing something. I would recommend for any like L4, L5 stuff, and if it is herniation that's going down the leg, true herniations that are causing symptoms, radiculopathy, like symptoms down the leg, those are really freaking painful. And they do take a significant amount of time to recover from. So sometimes back extensions can be helpful for those. Sometimes back flexion. So I would still encourage you, Jen, to see which motions are doable and which ones are not doable regarding like flexion, extension, and rotation, and also side bending and what's called side gliding. See which of those you can do and start there. I don't know if that's kind of what you've already been doing, but that would be my recommendation dealing with a herniated disc, trying to do it conservatively. Because in many cases, herniated discs do heal. They just take a while. And it's frustrating. So we will be here with you every step of the way to help you get through that. And if you need some extra help, you can reach out to me. I do virtual consults also. But it's tough. It's really tough dealing with that. Let's see here. Shafiq. Oh, Jennifer, you're late. It's all right. It's all right. I'll forgive you again. Shafiq, still have trouble standing and sitting for long, but I'm able to walk 3 times a day now for 15 minutes, which temporarily helps with my symptoms. Okay, that's good. That's good. So you might, to build your flexion tolerance, you might even want to start doing some like child's pose or something like that. I know you didn't want to add too many things, and we talked about adding one thing at a time. So that's something you could add into the mix potentially to see if it helps with your flexion tolerance. Child's pose and like cobra, like you've been doing. Let's see, rehabbing my own back. Doctor won't refer to aquatherapy until I finish physical therapy. I'm 6 weeks in already. Yeah, don't give up on the therapy 6 weeks in. A herniated disc often takes, in my experience, several months to find significant relief. And in the meantime, finding ways to get through your day. So whether that's a heating pad, usually there's like one exercise that you can do that at least gives some symptom relief. You said laying on my belly and seal arching is life, and I can only lean to my extreme right. Yeah, so I mean, that's what you start with. And what I typically will do with people who are dealing with that is slowly move into, I don't necessarily go into the most extreme movement that is uncomfortable. I'll usually start with the one that is like moderately uncomfortable and kind of push into it just a little bit and practice it just to see if we can modify symptoms at all that way. But yeah, and even if you can walk at all, like walk, that's a great way to just get some exercise in. And if you can get some upper body workouts in, I mean, that can also be really beneficial just to get a little bit of a sweat going. I know this might sound like too far along for you, but there are probably progressions that you could go through to help you get to that point. What have you been doing in physical therapy? Let's see. Cool. Yeah, Shafiq, let me know how it goes. Let me know how it goes. Jennifer, I'm thankful my pain has been pretty chill lately and really come to the conclusion that it is hormonal related, keeping track of symptoms. Nice. Jennifer, I think everyone, I want you to pay attention. Jennifer is doing something that I would highly recommend that everyone does when they're dealing with pain, is keeping a journal and seeing, because for Jennifer, she was talking that she was sharing a few times ago and today that she's pretty convinced that her back pain is hormonal related, which in some cases, yeah, for sure, like that's definitely plausible. And she's actually keeping a journal and seeing, okay, like when I notice X is happening, then my back pain is worse. So that's something to keep in mind, so you can actually start to modify your expectations, and you can also determine like, oh, okay, interesting. So when this is happening, I'm also having pain. So that's an important thing. I would like, nice. I'm going to love that, because some good stuff. See, I can walk now, but my right leg is immediately tingly. If I overdo it, it goes numb. I gotcha. Yeah, so that's tough. It's probably going to be a combination of prone press-ups, cobra, back extensions, side glides, and walking for you. So even if you can only walk for like a couple minutes and stop before it gets numb, then that can even be beneficial. And then slowly you can even record how far you walk in week 1, and then in week 2 you can see if you can increase that a little bit, and so on and so forth. So see if you can increase your walking tolerance. So sometimes we can only walk for 2 minutes before we have to stop, but then 4 weeks later, now we're walking 10 minutes. And I know that like, oh wow, 2 minutes to 10 minutes, like what is that? Well, that's a 400% increase. That's a lot. So, and it starts to build upon that once you're able to walk a little bit farther. So that might be something you try out too, just starting in small increments, gradual exposure to the activity. Even if it's a little uncomfortable, just pushing into it a little bit, but just making sure that you're not going into a full-on flare-up. And of course, like I haven't evaluated you, so I can't give like specific guidance, but that is what I do with clients here all the time who are having similar symptoms. Working into the discomfort a little bit, as long as it doesn't irritate it to a point where it's flared up for a day or several, and then adjusting that routine based on what we find. All right, so thank you all for joining. Any other questions for me before I hop off? I've got another client coming in here in 15 minutes, and we're going to get some deadlifts in. She's also been dealing with some neck and back issues, but we're gonna get after it today. Any other questions for me, guys? How do you like my new camera? Is it clear? Is it so clear that you can see the pimples on my face? Keeping track helps. Yesterday afternoon, I was in extreme pain. Well, I was very stressed. I'm guessing stressed. I was very stressed, had not moved from my desk, and had not taken my Advil or blood pressure meds or the med for depression all day. So instead of continuing to be scared about the pain, I realized I could do something about it. Hey, that's powerful. So that's another thing, is finding, like what Lisa was saying, is finding a way to feel like you can control it, that you are in control, that the pain is not in control. There's a book that one of my clients shared with me today. I just ordered it. It's in its 4th edition. It's called Manage Pain Before It Manages You. And I just thought that's such a smart title, because in a lot of cases, if we just let things go and go and go, and we don't find ways to control it where we take ownership, then oftentimes it will take control, and it can be just really challenging in that case. So yeah, I'm sorry that you're feeling that way, Lisa, but that's awesome. I realized I could do something about it. That's huge. And I encourage all of you to just meditate on that, because that's huge. Anik, how to endurance after back injury. I'm not having pain in the back right now. I also want to strengthen my back muscles. So now, if you're not having pain right now, but you've had it in the past, and you want to learn how to strengthen your back and just strengthen your body to reduce the risk of that, I'm going to say, number 1, start getting physically active. So start walking, walk more. The recommendation is for the United States, and I mean really humans are humans, so the recommendation is 30 minutes a day of aerobic activity, 5 days per week. So if you can start getting that in, even just walking is fine. And then number 2, I do encourage people to learn how to deadlift and squat and do different weight exercises. The reason is things always come up in life that require you to be able to lift weights. you're going to have to lift some amount of weight, whether it is dog food or cat food or a couch or a heavy object or a case of water or whatnot. So it's really important to build up that strength. So I do have a workout template that I've made. It's I can put the link in here, but it's also going to be included in a membership that I'm launching pretty soon with tons of cool content. It's going to have all of these videos recorded, and eventually these videos will be searchable, so you can just like type a question in and it'll like answer it, which is like such a sweet feature, but it's kind of expensive, so I'm not doing that yet. But anyways, I'm really excited to launch that. But building endurance after a back injury is definitely important. Strength is not everything, but strength is a big component of just living a healthy life. So if you strength train regularly and you get your aerobic endurance in regularly, 2 times a week strength training, 4 to 5 times a week of aerobic activity, like 30 to 60 minutes, you're in pretty good shape. And your risk of back issues is going to go down. Yeah, we don't have like conclusive evidence to say that like people who have much like stronger backs, however we would measure that, are at a lower risk of injury necessarily, or I'm sorry, a lower risk of back pain. But people who are more fit and active typically don't experience as many health issues overall, and that likely includes back issues. Yeah. Any other questions for me, guys? Great questions today. Keep them coming if you got them. I've got like 5 more minutes, and I haven't drank water this whole time, so getting quite parched. Let's see here. Cool. Well, it looks like we are all done. Doesn't look like we've got much more questions here. So thanks again for coming in and hanging out today. And yeah, I'm just really excited. So just a quick recap. We do these question and answer sessions, these Q&As every Friday at 4 p.m. This just happens to be the time that works best for me. As demand increases, I will increase the number of these if needed, but so far this seems to be a good flow. There's a giveaway that's happening. Look in the comments because there is a link there. I'm going to continue to post the link throughout the next 2 weeks. It's for a $200 Amazon gift card and a free worth $99. So total $299 value for participating in this giveaway. You're going to have a chance to win that. You don't just get it by participating. You have a chance to win if you enter and then do the different things it says to do. And that's to help build this group more, to serve more people, because ultimately my hope is that I can give people hope who are dealing with significant back issues, that there are solutions that they can take control. And so you guys can be an active part in that. So thank you for that, for participating, and I'm excited to see what happens in the next 2 weeks. We've got 6 people signed up so far, and with a lot of entries. So get on that. And then a book suggestion, Why Do I Hurt? Adrian Lowe. It's a really good one. And then if you're feeling stuck, just make sure to go through, take my Overcoming Back Pain course, watch the YouTube videos, ask lots of questions in here, and I'm sure that as you ask more questions, as you do more reading, you'll be able to work through some of those things. Oh, wow. Oh, and then let's see, diffuse idiopathic skeletal hyperbiotosis or hypertrophy for reference. I'm gonna have to look that up because I don't know what that is. So Lisa, squats and bad knees, yes or no? Yeah, I mean, I would start with box squats. Box squats, just like sitting down to a chair without weight, and starting with that. When people come in here with knee issues, that's usually where I will start them, is on box squats, because usually people can stand up and down out of a chair. And then also, if you notice that when you're warming up, like when you're doing warm-up sets, it's feeling better, that's a good indication. So I don't necessarily start people with squats if their knees are hurting, but usually most people can do box squats. If you can't do box squats, and like even after 2 sets of 10, it's not warmed up and still hurts, then I would recommend doing straight leg raises to warm the leg up, and then kind of going from there. Doing knee extensions with a band, that type of stuff. So just getting the quad going. Because to really address knee issues, my goal when anyone comes in with a knee issue is, can I get you back to lunging? Can I get you back to lunging? I don't care how old the person is. I have a 75-year-old who is lunging right now, and she's crushing it. And she's not really that in shape at the moment, but she can lunge. So it's just really important to build quadricep strength, especially as we age, because the quads are super important muscles, prevents our knees from buckling, all that type of stuff. So squats and bad knees, I say yes. Why not? As long as they're not flaring symptoms up. I think they're actually more protective of knees. And there's actually a study I was reading today showing that recreational runners have a lower incidence of osteoarthritis than people who are sedentary and of elite competitive runners. So if you're a recreational runner, it's great news. You're probably building up the resilience of your knees. And running has much higher joint forces than squatting. So squat away, as long as it's not flaring up symptoms. And ultimately, it's a great movement to build up quad strength. And if you can get to lunges, that's even better, because you can really blast the quads with that and get a great workout. And if you strengthen your quads, there is some literature to say that you will have less knee pain. Again, it's dependent, it's person to person dependent, but the literature does show that if you have an increase in quadricep strength, you might also develop less, or not develop, but get less knee pain. Yeah. All right. Well, I have talked long enough today. Thank you all for tuning in, my friends. There's really going to be some cool stuff rolling out here soon. This has been really fun. I'm always thinking of ways to make this more useful and more helpful and more fun for everyone. So I'm going to start rolling out some new things, some new challenges, likely some monthly challenges, and we're going to make this pretty fun. And it's going to go hand in hand with so the online version of what we're doing is Catalyst Online Wellness. My physical location is Catalyst Wellness and Physical Therapy. They're kind of hand in hand, but they're going to be collaborating. And so it's going to be a good time. Yeah, looking forward to this. And thank you all for being a part. Thank you all for being supportive of one another. That's huge. And I wish you all well. Have a wonderful weekend. And go get some activity in if you can. Take care.